Well, are you aware of how healthy the air you breathe in is? How healthy is the community you come from every single morning and return to every single evening? What's the sanitation like? Is it something that you're very observant with every single day, or you have to just wait for a pile of garbage somewhere to realize that, oh, there's poor sanitation in one place? Well, in our Tech Note this morning, we're going to be looking at improving safety in terms of hygiene as well as water. Globally, you get to have access to safe water, adequate sanitation, and proper hygiene education, and these can reduce illness, they can reduce death from disease, but also on the positives, they can lead to improved health and poverty reduction. They can also lead to socio-economic development. However, many countries are challenged to provide these basic needs to their populations, leaving people at risk of water, sanitation, and hygiene-related diseases. Of course, we have been coming from an Ebola outbreak. Most recently, you do have cholera that had stemmed in from the western part of Uganda. So all these relate to hygiene and sanitation. Now, I'm joined by Herbert Nabaasa, who's the Commissioner Environmental Health with the Ministry of Health, to talk to us about sanitation and hygiene and how it's equally as important for us to pay attention to and participate in actively for social and economic development. Good morning to you, Mr. Nabaasa.
Good morning, Priscilla.
You're most welcome.
Thank you so much.
Okay. So let's start with the basic understanding of sanitation and hygiene.
Yes. So basically, and good morning, viewers. Basically, sanitation are those facilities that are required at an individual level or facility level to ensure that we dispose of our fecal matter properly and adequately, but also that we have the proper facilities for hand washing after using the place of convenience. But also it involves proper disposal of other wastes within the environment that we live in to ensure that we don't have the vectors that carry diseases, but also ensuring that we step up efforts to prevent diseases, because these are mechanisms that diseases can actually be transmitted.
Okay, so I know that globally there is a global water, season that we are focusing on right now, and we do have the Sanitation and Hygiene Week that we are going to be participating in actively here under the Ministry of Health. Tell us about that. So
basically, yesterday we launched the Sanitation Week, and this week actually it was actually started in 2004 in Dakar, Senegal, and by the Global Wash Forum, generally to precede the Global Water Week, and usually it's celebrated between 15th to 21st of March. However, because of the different interventions of government, we have scheduled ours to start yesterday, 13th, up to 17th.
Okay.
And we shall be able to celebrate that in Mbale City at the Mbale School of Hygiene. The theme for this year is sanitation and hygiene for all, as the key for disease prevention. And I think the idea is to step up awareness for public to realize the importance of disease prevention, the departure from curative. Largely, you realize that we spend a lot of money trying to address disease, but also aware that about 75% of the diseases are preventable. So this is an effort to ensure that we avert most of the preventable diseases so that we are able to use resources in other related infrastructure like hospitals, rather roads, education, and others.
Okay.
So it's a call to ensure that the public is aware about the individual responsibility, but also understanding that it's actually important to prevent disease. So we are using this week to reflect as government about the lessons and interventions we had, but also to be able to share the gains we have in place. For instance, different policies we've developed, different guidelines we've developed, and also recently we've had the Public Health Act sent to by the President. We are using that to create enforcement, but also on one hand to raise awareness.
Okay.
So it's a very, very big mechanism for us as government, but also to help the public to understand their individual responsibilities.
In regards to status, what is our status as Uganda in terms of sanitation and hygiene, and what are some of those mechanisms that have actually aided in achieving that kind of status?
Yes, the status isn't very good, but we've seen some progress moving forward. For instance, we are talking about hand hygiene currently. standing at 45%. That's not a small achievement looking at where we're coming from, but looking at the remaining burden to achieve the 100% is still a huge journey. And you know that hygiene, hand washing is key in averting most of the preventable diseases. Then the other index or indicator is the basic sanitation. We are currently standing at about 36%, pretty not a very good figure. And basic sanitation basically refers to having a toilet facility where you can wash, but also not share with many people. Mm-hmm. We also have another bad indicator which is related to open defecation. That is standing at about 23% in communities, mm-hmm. and about 9% within urban areas.
Okay, so let's talk about the open defecation. Yes. I've seen it in the papers this morning. Yes. And what solutions can the Ministry of Health actually come up with to control that? Because at the end of the day, you then will be controlling disease spreading. Yes.
First of all, as government, we have developed a roadmap for open defecation free for all. But it's largely an attitude issue. In this era and age, you wouldn't expect somebody to walk away and you know, deposit their product anywhere they wish. And so we have that roadmap, which is spelling out specific interventions to support communities, but largely to work on the mindset change. And we still see this also in the towns. I told you 9% rather, within the urban setting, we still see open defecation. And so we need to use a multi-sectoral approach. Radios, the TV stations, the public, the church, and every other mechanism that we can use to reach out actually to raise awareness about the bad practice of open defecation.
Okay. Yes. All right. So in this year, what is the theme for commemoration, and how exactly will we have the public actively participate?
Yes, the theme this year is sanitation and hygiene for all, a key to disease prevention. And so we have set out activities for the week, which we launched yesterday. The major activity is the cleanup campaign within the communities. We have worked with local governments to ensure that they support communities up to the village level to ensure that every household stands up to clean their household, their homes, and remove all the environment that actually can be a condition for disease transmission. But also we are soon after this, we'll be looking at launching the National Cleaning Days, which will be a very big mechanism by government to ensure that every end of month we have everybody waking up to clean their environment.
Like what we say in Rwanda?
Yes.
Okay,
yes.
So on a Saturday morning, no work is prohibited, yes, communities get into the public space and get cleaning.
Yes, so we'll be launching it. We did not want to mix it with our sanitation week because we want to give it a high level awareness, but also getting probably the head of state to be the one to declare it because we want that level of government ownership.
Okay. Yes. And at the end of the day, away from this week, when it's done and dusted, as the Ministry of Health, how do you intend to continue on with ensuring that as Ugandans we enjoy the safe sanitation and hygiene?
Actually, the sanitation week is just to escalate what we've been doing on a routine. Work continues in communities, work continues in health centers, work continues in government. So we continue to, advocate for proper sanitation and hygiene, but also we regularly interface with the district to support them and also support communities to ensure that they enhance sanitation and hygiene. So after this, we'll just ride on lessons from the week to be able to escalate our interventions further into the communities.
Okay. In conclusion, while the week is going to be running, when it's done and dusted, how are you actually engaging the communities to actively participate in some of these mechanisms that you are deploying out?
Yes. In the communities, first of all, I mentioned earlier about the structures we have up the village level. Those are the VHTs, the village health teams. We have actually worked with them to ensure that we have mechanisms for working in small groups, and we are looking at establishing community committees that are going to be like watchdogs within their environments.
Right.
Why should somebody, for instance, shit in an environment near you? yet, or why should somebody have no latrine, and yet you are watching? So we are using that to a community ecosystem environment, but also creating the role models within the communities and ensuring that we have responsible leadership within the community. Somebody should be able to become like an example within the community and be able to, you know, carry on the message for sanitation and hygiene.
All right, Mr. Nabaasa, in your closing remarks as Commissioner of Environmental Health, what's your message to the Ugandan? The
message to Ugandans is, first of all, we have to understand that health, a clean and healthy environment, or living healthy, is an individual responsibility. There's nobody who's going to be responsible for your health. So at an individual level, within your home, within your house, as a household head, or you as a child, it is an individual responsibility to ensure that we do what we're supposed to be doing correctly to avoid disease. And so the message to you is that don't wait for government to come and construct for you, for instance, a latrine. This can be afforded. If you can afford to do other things and you can afford to treat yourself in the hospital, how about investing that small money into a facility, for instance, for sanitation? How about ensuring that you have hand hygiene within your environment, home or hospital, so we can collectively actually reduce the burden of disease and utilize the resources effectively into other social economic development avenues.
Okay. Yes. All right. Thank you so much, Mr. Nabaasa, Commissioner of Environmental Health with the Ministry of Health. We're going to bring this conversation to the end, going to a break. When we return, in our Kickstarter, there is a whole question of Kenya's ban on importation of Uganda's powdered milk. Of course, back in the day, there was the maize grain, then there was eggs in between there, now the powdered milk. What next in terms of bilateral relations within the borders of East Africa? With Chris Igeni, to stay with us.